Skin cancer in Australia is incredibly common. Over 50% of the population will develop some form of skin cancer during their lifetime. There are three main forms of skin cancer. The most common is a BCC, or a basal cell carcinoma. These are slow growing, but they don't spread. They don't go to the glands or the liver or the brain, but they do continue to increase in size until they're removed. The second most common form of skin cancer is an SCC, or a squamous cell carcinoma. There is a small chance of squamous cell carcinomas spreading, most commonly to the glands, but occasionally to other parts of the body as well. The most serious type of skin cancer in Australia is a melanoma. Melanomas are the most serious type of skin cancer we encounter in Australia. They potentially can travel to the glands or other organs and need to be treated very seriously. Skin cancers are very common, and the vast majority can be treated as day surgery under local anaesthetic. Most often the surgery simply involves cutting the cancer out and putting the wound back together with stitches. It normally takes between 20 and 30 minutes, and patients can go about their daily lives, although they can't perform any heavy exercise for at least a week after the surgery. Sometimes reconstructive surgery is required after skin cancer. The reconstruction may involve moving tissue around. That's called a flap, where we move tissue around with its blood supply intact to reconstruct the area where the skin cancer was. Other patients require a skin graft. That is where we take some skin from one part of the body and move it to another part of the body in order to resurface the area where the skin cancer was. Scarring is a concern after any form of surgery, especially skin cancer surgery, which is often on the face and nose. These scars can be red, raised and lumpy for many months after the surgery, but then tend to settle down into a fine white line. With flap surgery, the contour of the reconstruction also can be an issue, but again, with time, it does tend to settle down. With skin grafting surgery, often there is a mismatch in terms of colour and contour with the surrounding skin, but again, this is things that we can see if we can correct months down the track if need be. But most of the time, everything settles down and nothing further needs to be done. Most skin cancer surgery is done as day surgery under local anaesthetic. The patients go home, they shower from the following day, the stitches come out a week or two later, and they're getting back to their normal life after that. In terms of the recovery after flap surgery, they may have a little bit more swelling than if the wound has just been closed primarily. A skin graft involves moving tissue from one part of the body to another part of the body, and that requires a special dressing that needs to be kept clean and dry for at least a week after the surgery. After a skin graft, often it needs to be moisturized with Vaseline for a couple of weeks before it doesn't need any Vaseline or any special dressing. The recovery time after a skin graft, therefore, is slightly longer than the recovery as to when I've just cut the skin cancer out and put things back together again primarily.